So today you have 10 to 12 minutes to complete the NFPE. So you're just going to be doing the questions that are on the rubric and the stepwise guide. So you won't be going through the whole food and nutrition history that you've done previously last week. And then when we're finished here, then you'll be going back into the main Zoom room or your main class at 2 o'clock. So Dr. Radler and Professor Payuela could talk about any questions you have for the final exam. And this is recorded, so you're able to go back and review your NFPE and take a look at how you did. And also I'll be filling out your rubric, which, basically has done with some errors or not done if you missed a step. So we're going to get started just to keep in time with everything. So our first student that is up is Marwa.
I hope it's not a huge inconvenience, but if I could go last, maybe. My brother is just at physical therapy right now, but he'll be here maybe like a little after 1. I'm sorry.
Not a problem. That's okay.
Thank you.
How about Sarah? Is your volunteer there?
Yep, I'm ready to go.
Okay.
All right, just let me know if like the camera needs to move. I'll try to move it accordingly. Can you move closer? Okay, does that look okay?
So right now it's just the upper body. You're going to move to the lower body when you need to.
Yes, yeah.
Okay.
Okay. All right. So hello, my name is Sarah. I'm your dietitian today.
Hello.
Can you tell me your name and the month and year?
My name's Joanne, and it's December 2021.
Perfect. Are you on any medications?
I'm on vitamin D and fish oil.
Perfect. Good to know. Okay. And are you having any problems eating? Any differences in taste?
No.
Okay. Any pain while eating?
No.
Okay, perfect. So we're just going to go through a short nutrition focused physical exam, going through your upper body, a little bit of your lower body, and your oral region. Okay.
Okay.
All right. So I'm just going to put on my gloves if you give me a minute. Okay.
Good.
Okay. All right. So the first thing I'm going to have you do is just make an okay symbol with both of your hands. Perfect. I'm just going to feel here. Great. I just want to make sure I was on camera. Awesome. All right. So just checking your fat stores there.
Okay.
Okay. Now I'm just going to palpate your neck down to your shoulders. Just let me know if there's any pain or anything. All right. It feels good.
Mm-hmm.
Okay. I'm just going to look at your clavicle now. Okay. Perfect. All right. So now I'm going to have you push against my hand. So push, and then I'm just going to feel your scapula here, or sorry. Yeah. And I'm going to feel your ribs as well. Okay, good. And we're going to do it on the other side. Okay, great. Awesome. So everything feels fine.
Okay, great.
All right. And then I'm just going to move down to the lower region. Okay. So I'm just going to feel around your knee. Any pain or anything?
No.
Okay. Feels the same on both sides?
Yes.
Okay. Just feeling here. Awesome. All right. Now I'm going to have you straighten your leg. Okay. Can you point your foot and flex it? Awesome. Okay. Now this foot, point and flex. Great. Okay. All right, now we're just going to do the facial region. I am going to change my gloves.
Okay.
Just because I touched all your clothes and all that. So now we're just going to go over the facial region as well as the oral region. Okay. Okay. So I'm going to feel your temporal region. All right, that feels fine. I'm just going to feel your TMJ. If you could just open your mouth. and close. Perfect. All right, now I'm just going to feel under your eyes. Okay. Great. All right. Now we're just going to test some of your cranial nerves. So give me the back of your hand. Okay. This is going to be soft.
Okay.
And this is going to be hard.
Okay.
Okay. So close your eyes. Is this soft or hard?
Soft.
Okay. And is it the same on both sides?
Yeah.
Okay. Soft or hard?
That's hard.
Yep. Same on both sides?
Yes.
Great. Soft or hard?
That was hard.
Okay. And same on both sides?
Yes.
Great. Soft or hard?
That was soft.
Okay. And same on both sides?
Yes.
Great. Okay. Hard or soft?
That was soft.
Okay. And same on both sides?
Yes.
Okay. And one more time, hard or soft?
That was hard.
Okay. And same on both sides, right?
Yes.
Great. Okay. So now I'm just gonna take a look into your mouth. Can you just say ah? Okay, perfect. And can you move your tongue back and forth? And up and down? Great. And then just push your tongue against my hand through your cheek. Great. Okay, awesome. Now I'm just gonna use the tongue depressor and just take a closer look. Okay. Seems like you have all your teeth. Everything looks good. Can you just lift your tongue a little bit? Look down for me, just so I can see. Great. So you have saliva forming in there. Your gums look good. And everything looks moist. Perfect. So we're all set. Do you have any questions for me?
No.
All right. Thank you so much for meeting with me, and I really appreciate it.
Well, thank you.
Yeah, of course.
Okay.
Ta-da. Yeah. Oh, shoot, forgot the parts. Okay. All right. Thanks.
Okay, thank you. So next up, let me see who's next. Next up is Mason.
Okay. Hello, nice
Hi.
to meet you.
Nice to meet you too.
My name is Zoe. I'll be your registered dietitian. Today, I'm just going to be asking you a few questions, and then I'm going to perform a nutrition-focused physical exam. Does that sound good to you?
Yep, sounds good.
Okay. So, can you tell me what your name is?
Ava Fernandez,
And where are we today?
your bedroom,
And what state is that?
New Jersey,
Okay. And can you tell me the month and the year?
December 2021.
Okay. Can you tell me about any medications or supplements that you're currently taking?
I'm not taking anything.
Have you been experiencing any dry mouth or feeling like you can't eat anything without of water?
No,
Okay. Have you experienced any distorted taste, lack of taste, or inability to taste certain foods?
no,
Okay. Have you experienced any pain in your mouth or changes with biting, chewing, or swallowing?
no.
Okay. So now I'm just going to put some gloves on. I'm going to start with assessing your muscle and fat stores. I'm going to start with the interosseous muscle of your hand. So can you make an OK sign? Okay, good. And while I'm here, I'm just going to look at your skin tone. Everything looks even skin tone. Your hands aren't too dry, not too moist. I can do the same thing on the other side. Okay, good. And now I'm just going to assess the muscle and fat stores of your bicep and tricep. So can you make a right 90-degree angle? Good. I'm going to do the same thing on the other side. Good. Now I'm going to assess the muscles of the shoulder region, And while I'm here, I'll just test your trapezius strength. So can you shrug your shoulders against my resistance? Good. Okay, and I'm gonna move to the clavicle region. Okay. All right, good. Now I'm gonna have you push your arm against mine. I'm just gonna feel for your muscles along your scapula. And I'll have you lift your arm up, and I'm gonna feel the fat stores around your ribs. Perfect. I'm gonna do the same thing on the other side. I can lift your arm up. Okay, nice. Okay, now we're gonna move down to the lower body region. So you can just keep your legs flat on the floor, and I'm going to palpate your patella region and have you lift your leg up, and I'm gonna feel your quadricep muscles. Perfect. The same thing on the other side. Good job. Now I'm gonna have you extend your leg out and lift it up and flex and extend your foot. Just gonna palpate your quadricep muscle, or I'm sorry, your calf muscle. And while I'm here, I'm going to assess your fluid stores to assess for edema. Now we'll do the same thing on the other side. Flex and extend. Good job. Okay. Now I'm going to switch out my gloves so we can start examining the facial region. So first I'm going to assess your orbital fat pads underneath your eyes. So I'm going to be touching your face. You can close your eyes for that. Okay, good. Now I'm going to assess the muscles of mastication, so the muscles of chewing. Your temporalis muscle. Can you clench your jaw for me? Good. Now the masseter muscle. And now can you open and close your jaw? I'm just assessing the temporal mandibular joint. Was there any pain with that?
No.
Good. Okay, now while I'm here, I'm just gonna like assess your hair. It looks healthy. It's like a nice color. It's not too dry.
Thank you.
Okay, so now I'm gonna have you do a dry swallow for me. So I'm going to put my hand along your neck, and can you swallow? Good, nice coordinated swallow. Can you clear your throat for me? Okay, good job. Now I'm gonna assess the cranial nerves, starting with the trigeminal nerve. So can you move your jaw from side to side? Okay, good. And now can you open your jaw against my resistance? Nice, okay. Now we're gonna assess the sensory function. So can you put out your hand for me? This is gonna be the soft side, and this is gonna be the hard side. So I'm gonna have you close your eyes, and I'm gonna test your sensory function along the 3 branches. Close your eyes. Is that the hard or soft side?
Soft.
Was it the same on both sides?
Yes.
Is that the hard or soft side?
Hard.
Good. Was it the same on both sides?
Yes.
Okay. Hard or soft?
Soft and same.
Okay, good job. Okay, so now we're gonna assess the facial nerve functions. We're gonna make a few funny faces. Can you lift your eyebrows for me? Good. Can you make a frown? Good. Can you smile? Good. Can you puff out your cheeks? Good. Can you purse your lips like a fish? Nice. Okay, everything looks very symmetrical. So now I'm going to assess the accessory nerve function. We already did the trapezius. Can you look from both or to both sides, assessing the sternocleidomastoid? Good job. Now, can you push your tongue against my hand here? Assessing the hypoglossal nerve. Good. Okay, now I'm going to take a look inside your mouth. So can you open your mouth nice and wide for me? Good job. Open it a little wider. Can you say ah? Okay, good. I'm gonna grab the tongue depressor and look around at your teeth. Looks like you have all your teeth. Looking at the hard and soft palates, I don't see any redness or lesions. Can you put your tongue against the top of your mouth? Okay, good. I see good pooling saliva. Can you close your teeth together? Good. You have nice biting surfaces. Okay, so now I'm going to just take one of my gauzes and take a look at your tongue. I'm just going to wrap this around your tongue and then look around all sides. Okay, good. Looks good. Okay, now I'm just going to look at the labial and buccal mucosa. So I'm just going to lift up your upper lip. Okay, your lower lip. Okay, good. All right, so you're all set. Overall, you have adequate muscle and fat stores, and I don't see any signs of dysphagia or malnutrition, and I don't really see any signs of nutrient deficiencies. So you're in great shape. Thank you for coming in today.
Thank you.
Okay, thank you. Next up, we have Ben.
All right. Trying to find a good spot to put the computer. Let's see. Yeah.
Need the light on.
Yeah, you can turn it on.
Oh, light might be better.
There you go.
Here, or is this good?
Everyone see that? That's a good angle. Okay, great. All right. All right. Hi, Mrs. Patrinas. My name is Ben. I'm a nutrition student here at the hospital. How are you doing today?
Doing well, thank you.
Good, that's good. So as I said, I'm a nutrition student here, just coming to do a nutrition-focused physical exam. So what that is, it's basically a small set of interview questions assessing your nutrition, your eating habits, and so some other things along with that. And then we'll go through a physical assessment, looking at your upper body, lower body, and then some facial assessment as well.
Sounds
All
good.
right. All right. So just starting with the questions. Can you please just identify your first and last name?
Christine Virginis,
Great. And where are we right now?
Lancaster, PA, in
You
a
got it.
bedroom.
And what's the month and year?
Oh, God. December 2021.
Yeah.
Sheesh.
Yep, you got it. All right. Are you currently consuming any over-the-counter or prescription medications or dietary supplements?
Just a multivitamin, two a day, and vitamin C, 500 milligrams.
Okay, good to know. Good to know. Any altered taste or feelings of dry mouth?
No.
Okay, great. Any pain in the mouth when you eat or chew?
No.
Great. And any difficulty with biting or chewing or swallowing difficulty?
No.
Great. All right. So that's all the questions that I have for you. So we're just going to jump right into the assessment portion.
Okay.
So let me just put my gloves on real quick, and we're just going to start with the upper body. All right. So you just want to make an OK sign with your index finger and your thumb pointing down at me. There we go. I'm just assessing the inner osseous muscle right here. All right, both look good. Next thing I want to look at is you put your arm at a 90-degree angle. I'm just looking at fat stores on the biceps and triceps. Which both look good, and we'll assess this arm as well. All right, both feel good. Now we're just looking at the shoulder region. So I'm going to start around your trapezius, palpate down to your acromion process, and feel how everything is up here. So feel a good feeling acromion process, and then the deltoid muscles are symmetrical. Then I'm gonna assess the clavicle by scooping under and above. That look good. Looks good. All right, then I'm just assessing the scapula. If you want to sit up on your chair a little bit. Great. So we're assessing it with the patient at rest. Which feels good. With the feel good, and then if you want to apply pressure to my hand. There we go. I'm assessing the scapula as well with the arm extended. All right, and same with this arm. All right, perfect. All right, next thing I'm going to look at is just your skin, hair, and nails. So if you just want to give me your arms, I can just assess your skin like that. The skin is looking moist, not dry. It's a good color and good texture as well. And this arm, yep, same thing. So skin looks good. And for your nails, nails have good texture. They're not brittle. There's no abnormalities in the concave nails. Look good. I'm just gonna look at your hairline, if that's all right.
Sure.
All right. So hairline looks good. All right. Good quality and texture in the hairline as well. All right. So the next thing I'm going to look at is your face and head region. So I'm just going to palpate the your orbital fat pads under your eyes. All right. Yeah, those feel good. So that's indicative of muscle stores. So good muscle stores under your eyes. Next, I'm just going to look at your temporalis, your TMJ, and then your masseter or your muscles of mastication as well. So these are all involved in the chewing process of food.
Mm.
So just feeling your temporalis muscle for any wasting, but that feels good. And then your TMJ. Can you just open your mouth for me? Any cracking or popping?
Nope.
Nope. All right, and then just clench your teeth. Great. All right, perfect. Can you just open your mouth for me as wide as you can? I'm just gonna measure 3 fingers width. Looks great. Perfect. And then if you just clear your throat as if you would have anything stuck in your throat that you'd have to. Perfect. All right. All right. All right. Now I'm just gonna do a 4-finger swallowing test. If that's all right with you. I'm just gonna. All right. So I'm putting a finger submandibular, one on the hyoid, and then others on the trachea. So you can swallow. Great. So there we're just looking for a straight linear swallow and no abnormalities with that. All right. Perfect. So next we're just going to go into the lower body assessment. Change my gloves. All right, so we're going to look at your lower body. So if you want to bring your knee up a little bit, we're going to assess the quadricep muscle. So palpating proximal to the knee, so that looks good. Put that down. We'll assess this one. The muscle feels firm. Good quadricep muscle, and then looking at the patella. Yeah, okay. The muscles around the patella. These muscles feel adequate. And same with these as well. Perfect. Now just looking at your calf muscle. If you want to flex your calf muscle for me. Flex the calf. Perfect. And then extend the calf as well. All right. Good stores there. And same thing on this side. We're going to flex it. All right, and then extend it. Perfect. All right, and then I'm just checking for edema down here. So I'll apply 2-finger pressure down to the skin, and the skin rebounds well. Not indicative of any pedal edema, so that's a good sign as well.
Good to know.
So working back up to your face, just gonna assess some nerves up in your face. So the first nerve we're going to assess is the trigeminal nerve, and that's the nerve that has both motor function and sensory function as well. So the motor function is just your jaw just moving back and forth. You can just move your jaw back and forth.
Oh,
perfect. And then I'm going to apply resistance and just open your mouth. Perfect. All right. And then the sensory portion of that. That sensory portion of that nerve.
Could you move the camera back up?
Oh.
Oh.
There you go. Sorry. And then the sensory portion of that nerve is just using the cotton tips to sense your how you can feel. Yeah. Let me just put these gloves back on.
Do it again so they could see it.
All right, so if you want to give me your hand, I'll show you what the soft feels like. So that's what the soft end feels like. And this is what the hard end feels like. All right.
Mhm.
All right, so if you want to close your eyes, we'll get started with this. All right, what does that feel like?
It feels soft.
Soft, same on both sides?
Can you do it again or no? Yeah, same on both sides.
All right. And what about that feeling?
That's the hard on both sides.
The hard on both sides. All right, and what about that?
Soft
Soft
and hard.
and hard. All right, and what about that one?
Soft.
Soft. And what about that? And same on both sides?
Actually, the left felt soft and the right felt hard.
I'll try that again for you.
I guess they're both hard.
Both hard? All right, perfect. So as I said, that's the trigeminal nerve that we're assessing there. So the next nerve is just the facial nerve, and that is the nerve responsible for all facial expressions. So if you just raise your eyebrows, puff out your cheeks, and purse your lips, and smile. There we go, and frown. Perfect. All right, everything looks good with that nerve. Next nerve is just looking at the glossopharyngeal and the vagus nerve. So I'm just going to grab, just open your mouth and just say ah for me.
Ah.
All right, looks good. So that you the palate elevation, which is what you want to see. All right, so next nerve is just the hypoglossal nerve, which is responsible for all your tongue movement and function. So you just protrude your tongue for me, and then move it left and right, and then up and down. Great. And then I'm just going to apply my hand to the outside of your cheek. If you just want to apply pressure with your tongue. Great, I can feel that. Great, so good strength with your tongue there. All right, and the last nerve we're going to assess is just this accessory nerve. So I'm going to assess your sternocleidomastoid, which is a muscle in your neck, and then work down your trapezius muscles as well. So this all feels well. And then trapezius work good well. All right, and can you just turn your head left and right for me? All right, any pain or discomfort with that?
No.
No? All right, and then just shrug your shoulders for me. Perfect. All right, good shrug against resistance. All right, and then the last thing we're going to do is just a intraoral examination. So let me just get my gloves on for you. Put new gloves on for you as we go into your mouth. As I put these on, any issues with chewing or swallowing or any pain in the mouth?
No.
No.
Nope. All good.
Any teeth pain or any use of dentures?
No.
No. Okay. Perfect. Right. The first thing we'll just look at is just some dentition. So if you just want to open your mouth, I'm going to take a look at your teeth. All right. Patient accounts for all teeth, and all teeth are straight. And if you just want to put your teeth together and just open your mouth. Perfect. All right, and the occlusion is good as well. All teeth are straight and they're in a good and ordered pattern. All right, now just looking at the soft tissue. First thing we're going to look at is the labial mucosa and gingiva. So it's I'm gonna lower your bottom lip and raise your top lip. All right. All right, things look good. Tissue looks good along with the gingiva as well. All right, perfect. Next thing I'm going to look at is the buccal mucosa on the sides of your inside of the cheek. Let me just get the tongue compressor. All right, we'll go on your left side first. All right, looks good. And same on this side. All right, everything looks good. Next, I'm just going to look at the floor of your mouth. So if you just want to open your mouth and raise your tongue. All right, things look good there. There's pulling saliva and it's all moist down there, which is what you want to see. Next thing, if you just want to tilt your head back and open your mouth, I'm looking at the soft and hard palate as well, which both look good as well. Perfect. All right, last thing we're looking at is just your tongue. So let me just grab the gauze pad. I'm just going to briefly grab your tongue, look for any ulcers or sores or any abnormalities.
All right.
All right. This thing out. There we go. All right. There we go. Grab the tongue. All right. The tongue has good color, and all 4 sides of the tongue are clear of any ulcers or any sores, which is great. So that concludes everything that I needed. So just to give a little recap for you, there are no signs of any micronutrient deficiencies or no sign of any malnutrition as well. Seems like you have great control of the nerves in your throat and your face, which is great because that's not indicative of any dysphagia risk as well. So I'm going to use all this in my assessment, but we'll be in touch soon. If do you have any other questions for me?
No, I think I'm good.
Great. Well, thanks so much for coming in today.
Thank you.
All right.
Have a good day.
Okay, thank you. And now up Marwa, if your volunteer is here.
Yeah, he's here. He just got here. I don't know, Victoire, would you mind going before me? I'm sorry.
I actually don't have a volunteer. I'm sorry.
Oh, okay. All right. All right, come here. Sorry. Okay. All right. Put this up for you. Okay. Hi.
Hi.
My name is Marwa. I'm a dietitian.
Nice
Nice to meet you.
Yes, sir.
Is that how you want to be addressed?
Yeah.
Okay. So today I'm going to do a nutrition focused physical examination. So I'm going to be assessing your muscle and fat stores as well as the strength of your muscles. And then I'm going to be touching your face a little, looking inside your mouth, and testing some cranial nerves as well. Does that sound okay?
Yes.
Okay. So first I'm going to ask you a couple of questions. Could you tell me today's date?
December 2nd,
What year is it?
2020.
Okay. And can you tell me where we are right now?
The office.
Okay. Okay. So are you taking any medications currently?
No, I'm just like a multivitamin.
Multivitamin? Okay. Do you experience any like side effects with that? Nausea, vomiting? No? Okay. Do you have any like dryness in your mouth ever? When you eat, do you feel like you have to have a drink while you eat? No? Okay. And like, do you have any problems swallowing ever? Swallowing food? How about biting food?
No.
Okay. Do you have any pain in your mouth? Any pain in your teeth or gums?
No.
Okay. Any muscle soreness at this time?
Not really.
Okay. All right. So I'm going to get into the fat and muscle assessment first and just put on some gloves. All right, I'm going to start with interosseous muscle, which is between your thumb and your index finger. So can you make okay signs like this? Thank you. Okay, good. I feel adequate muscle there, so you can put your arms down. But can you raise one arm like this, 90 degrees? Okay, thank you. Just gonna assess your bicep and tricep. Okay, kind of see on the other side. Okay, there's a good muscle to fat ratio there. And then I'm gonna look at your collarbone, your clavicle. Okay, I don't see it protruding, which is good. And then can you just like go like this? Okay, just feeling your muscles, you put your arms down. And then can you put your arms out, put one arm out like this? This one is good. Okay. If you could push against it. Okay. I'm feeling your shoulder here. There's good strength there. Thank you. I see this is the same on both sides, which it is, which is good. Okay, and then we're gonna move on to, actually I'm gonna feel around your ribs a little bit. Is that okay? Okay, you lift your arms a little bit. Here I'm feeling for fat as well as muscle, so I don't really feel your ribs or anything protruding, so that's good. Okay, so moving on to the legs, you could keep your knees at a 90-degree angle. Yes, that's perfect. I'm just gonna feel around your patella, which is your knee. Any pain? No? You sure? Okay. All right, and I'm gonna feel onto your quads as well. Good muscle strength there. And then can you lift your foot and then point your toe outwards? Yeah, point it that way. Yes, thank you. I'm feeling for your calf muscle here. I'm gonna do the same on this side. Point it out. Thank you. That felt good. Okay, good. Any discomfort at all with that? No? Okay, good. Okay, so I can move on to the orofacial exam now.
Sure.
I'm just gonna change my gloves really quick. Okay, so first we're gonna test your trigeminal nerve, which is involved in like sensation. So can you put your hand out like this? Okay. I'm gonna show you, this is the soft side, and then this is the hard side, okay? So, but if you could close your eyes for me while I do this, I'm gonna put these on your, put your hand down, sorry.
Oh.
I'm gonna test it on your face. Okay, keep your eyes closed and tell me what you feel. Okay, did it feel even on both sides? Okay,
No.
did that feel even on both sides?
Yeah.
Okay, lift your hat a little. Soft, and did it feel the same on both sides?
Yeah.
Okay, all right. So I'm going to then ask you to open your mouth, please. You open it wider, okay? And then close it, and then open it again. Move it from side to side. Your jaw. Okay. While I'm here, I'm gonna feel around your temporal, your TMJ. Oh no, I'm sorry, that was your TMJ. I'm feeling your temple muscle now. This just looking for any muscle wasting, which I don't see any, which is good. If you could just lift your hat a little, just so I can assess your hair. Good, yeah, I don't see any hair loss really, so that's good. Okay, so moving on, we're going to oh, okay, yes. Can you make a few faces for me? Like, can you smile? Can you frown? Can you puff out your cheeks? Okay, can you like purse your lips? Okay, and then can you seal your lips too? Okay, that's important to know if you like have any, because that's important for like eating and swallowing, right? So, all right, I'm gonna then assess your spinal accessory nerve. So I'm gonna get behind you here, just feeling your shoulders. Can you shrug your shoulders against resistance? Okay. Okay, good. And then can you move your head from side to side against the resistance of my glove? Okay, and then, okay, good. So now I'm going to move on to the intraoral exam, which is inside your mouth. So if you could just open again for me. open bar, please. Okay, thank you. Okay, I see the linea alba on the inside of your cheek. So the color looks good. Everything's nice and pink. It looks moist. And then can you just open your jaw against the resistance of my hand? Good. Okay, good. Okay, and then back inside the mouth. If you could open and say off. Okay, good. I saw your soft palate rise, so that is good when we're looking for a dysphagia or like difficulty swallowing. So, okay, and then I am just gonna assess your tongue a little further. So I'm just gonna hold on to it with some gauze. Okay. Please stick out your tongue for me. Okay, good. I don't see lesions or discoloration. I see pooling of saliva at the bottom of your tongue as well, which is good. Okay, and then I'm just gonna get behind you here. I'm gonna ask you to dry swallow. Okay, any issues with that? No? Okay, and then can you clear your throat with your mouth closed? Okay, did that hurt or anything?
No.
No? Okay. Well, I think that will conclude our assessment today. So I'll just go over what we, some of my findings. I didn't see any signs of muscle or fat wasting. Your muscle strength is good, and your cranial nerves seem to be intact. Everything looks good. So do you have any questions for me?
No questions.
Okay, well,
Thank you so much.
Yeah, thank
Yep.
you for coming here. All right.
Okay, thank you. So you've all gone for today and, did this part. So I'll be filling out rubrics for all of you. That went quick, so I need to refer back to the video because I wasn't quick enough. And then your video will get posted in your assessment class. And I know you have to fill out a self-evaluation and then you'll see the rubric too. So that's it for today. And then you have to meet back up in your assessment class at 2. So I don't know if anyone has questions about anything. If not, you're free to go until 2. But good job, everyone. I know it's not easy, and the more and more you practice this, the easier it gets, the more comfortable you feel. We give you a lot of opportunities. You'll get to do this again in MNT2, and then we do these in the workshops. So, just keep grabbing everyone at home and doing this to them. So it's the only way. All right, well, have a good rest of the afternoon. And then, well, I'll see you next week, but good luck with finals too.
Thank
Study.
you.
Thank you.
Thanks so
You're
much.
welcome.
Thanks for waiting too.
Oh, no problem.
All right, bye.
Bye.